Hello, my name is student Dr. Cameron Lindemann, and today I'm going to be presenting the case of Trenton. So as I present Trenton's case, I'm going to start off by telling you the things that we know about Trenton, as well as presenting the things that we need to know, or the information deficits that exist about Trenton's case that are pertinent to his treatment. So first of all, Trenton is a 22-year-old Caucasian male complaining of a dull ache in his abdomen. First of all, we need to know if in fact Trenton is physiologically and anatomically male. He identifies as a male, but we really need to know what his physiology is so we can treat him accordingly. Next, we need to know exactly where this dull ache is in his abdomen so that we can know what organs are underlying that. He's described as having minor distension and slight protrusion. The words protrusion and distension are very ambiguous terms, so we need to get more down to the bottom line of what those actually mean. Trenton today is presenting with a temperature of 100.2, which is a little bit high. Again, not super concerning though. We know that he has occasional blood in his stool. This is a very important piece of the case, and we need to know what color this blood is in his stool. Is it a red, bright blood, or is this a dark and tarry look in his stool? He says he's feeling uncomfortably full after eating a meal. We need to know, is this nausea, or is this I just ate 3 pounds of turkey and I'm ready to stop eating? He says he recently graduated from college and moved from Oklahoma to Colorado to start a new job after graduating. On top of that, his parents are upset with him because he opted to not go to law school like they wanted. And so we need to know about Trenton, how this is making him feel. Is he stressed about it? Is he worried about it? Is it affecting his health? He says he's losing weight. We need to know how much weight he's lost and in what time frame. Last on this slide, it says he's been eating a lot of Mexican food and drinking lots of tequila, in his own words, more than he should. We need to know what this means. Does he just feel guilty for having a little bit of alcohol, or is he truly binge drinking and causing himself harm? So now we know a little bit about Trenton's case presentation, but this only makes us more curious about what's going on with Trenton. So we really need to dive in deep and do our research and ask the right questions so that we can find out what's really wrong with Trenton and we can help him. So the way that you do that is we first come up with a differential diagnosis. And I have here listed 5 things. I'm going to start with the second thing on the list. So this is an abdominal aortic aneurysm. So Trenton fits a few of the presenting characteristics of this disease, mostly just abdominal pain. The reason I have AAA on my differential list is because this is an extremely emergent diagnosis, and if Trenton really has this, we need to get him help right now. But I didn't feel Trenton fit this very well, so I threw that out, just put it up here because I wanted to check it out for him. The next is alcoholic liver disease. So this presents in patients who are alcoholic, and it may present with fever and anorexia, which all kind of fit for Trenton. However, patients typically present with rapid onset jaundice, which is not described in Trenton's case presentation. Next is appendicitis. So Trenton fits the age of appendicitis. It would present with abdominal pain, which he has, could possibly have some distension. However, we would not expect to see blood in the stool with pancreatitis or with appendicitis, and the physical exam would show rebound tenderness and a positive arousing sign, which are not described in this case presentation. Last is diverticulitis. So patients with diverticulitis present with abdominal pain and bright red blood in the stools. So this would fit with Trenton. However, diverticulitis typically presents in the older population. Specifically, 80% of patients are over 85 years of age. So last, the diagnosis that I'm choosing to run with in this presentation is acute pancreatitis. So it's consistent with the abdominal pain, and it is consistent with his alcohol use. 25 to 35% of cases of acute pancreatitis are because of alcohol use. This could cause bleeding because of a duodenal ulcer, which is strongly associated with pancreatitis. People who have duodenal ulcers are more likely to get pancreatitis. And Trenton could have had a duodenal ulcer previously because of stress, and that was described in the blood in his stool that had been going on for a while before the abdominal pain set in. So if we look at them as two almost separate diagnoses, the duodenal ulcer points us again to pancreatitis, which fits all his other symptoms, such as the slight fever, and again, the pain and the alcohol use. So all these things point us to pancreatitis. So we now are opened up to even more questions. We need to ask more clinical questions now to hone in on this diagnosis of pancreatitis and make sure that this is really what Trenton has, so we can get him the best care that he needs. So some of these things we need to look into are his other vital signs. So as I mentioned, he should have a fever if he has pancreatitis. And consistent with this diagnosis, we would expect to see hypotension, tachycardia, and tachypnea. We would want to do a complete blood count to see if his white count is elevated to indicate infection of any kind. We would also want to look specifically at amylase and lipase values. These enzymes are elevated in pancreatitis patients with a 97% specificity. So this is a really good tool. If these are elevated, 97% of the time, the patient has pancreatitis. So we want to look at this. We also want to look at Trenton's general appearance. Does he look sick? A patient with pancreatitis would look sick. They could also present with echymosis, which is basically a bruising due to exudates from the necrotic tissue. We next would want to get images on Trenton, specifically an ultrasound, a CT, and an MRCP, all of which would just give us a good focused look at Trenton's pancreas so we could see what's going on there and help him out more. So in seeking to help Trenton out, the next step we need to take in our quest for the perfect treatment and diagnosis for Trenton is to understand the pathophysiology of pancreatitis. To do that, we need to take a step and look at the physiology. So the pancreas is going to secrete from its acinar cells certain digestive enzymes such as trypsin and chymotrypsin, things like that, which digest proteins and fats. They travel through a system of ducts and meet up with the ducts from the gallbladder, the cystic duct, and empty into the duodenum, where they can aid in digestion. So that's what's supposed to happen. In pancreatitis, we have the enzymes sitting in the pancreas for too long, and so they start to digest the pancreatic tissue itself, which is a big problem. This can happen from an obstruction, perhaps from the bile duct, from a gallstone, or something like that, or from an alcoholic pathology. So that's what I focused on because I felt this fit Trenton a little bit better, even though it's very likely he had a gallstone. But alcohol is very interesting pathology in interacting with the pancreas. Alcohol will stimulate the excretion of a protein or of a hormone called cholecystokinin, or CCK. CCK is the hormone that stimulates pancreatic secretion of these enzymes. So if CCK is higher, we'll have more enzymes secreted, and the more enzymes, the more likely they stay in the pancreas too long and get activated from their inactive zymogen form, which they are, that's how they're first packaged and sent out, and once they're activated, they do their damage. So alcohol is basically upping the chances that these enzymes get activated in the pancreas itself. Now, CCK will also have its own way of cleaving or activating these, what's called zymogens. That's the inactive form of these enzymes, and activating them to the active form so that they can start their digestion. So here's just another diagram of what I just talked about. You can see the acinar cells secreting their zymogens, and then you can see them getting activated and doing their destruction and leaking into surrounding structures. The surrounding structures of note would be the aorta, superior mesenteric artery, and the IVC, and that's what we would need to look for. So because of the urgency of Trenton's illness at this time, we would admit him to the ICU almost immediately to give him aggressive hydration and oral feeding to make sure he replenishes the nutrients that he's lost. We will want to give him some enzyme inhibitors to hopefully slow down those enzymes that are digesting his pancreas, and also give him some somatostatin, which is the body's hormone that it uses to decrease the pancreatic enzyme secretion. We would give him some prophylactic antibiotics just in case there's any infection. We don't want that spreading. Give him opioids or other pain medications. If in fact it is a ductal obstruction, we would give him, we'll have a cholecystectomy to take out that gallbladder and the stones with it. If there's dead pancreatic tissue, we would want to do a necrostectomy. And we definitely want to educate Trenton on better alcohol use and not abuse of alcohol. This is the most important part of our treatment for Trenton today. So as always, we need to consider ethics when we are treating. So autonomy, we need to make sure Trenton is making his own decisions, that he understands risks and benefits of not doing the procedures and doing the procedures. We need to make sure that Trenton feels that what he's doing is best for him and that we are doing what's in his best interest. Beneficence is interesting in this case because some of the treatments, such as a cholecystectomy or the hormone therapy, would be that he would have to change his diet pretty radically. And sometimes patients feel like that is not worth it to them. We would need to explain again the risks and benefits to Trenton and make sure we're doing what's best for him with these more intense therapies. Again, we need to make sure he knows that he's causing himself harm by continuing to drink alcohol at the rate he is. And we want to be sensitive to how Trenton is feeling about his whole situation with his family and his new job, and make sure that he knows that though alcohol was harming his body, he isn't the problem. Trenton is not a bad person because of that. We just don't want to add stress to how Trenton is feeling in this situation. So that's what I mean by being sensitive to how he feels. So last, I just want to leave with the fact that Trenton is going to be okay. 80 to 85% of cases of pancreatitis resolve themselves. And so thank you so much for listening to me today, and I hope you have a great day.